Next, from the state capitol, we speak with State Representatives Lisa Dugan and Don Moffitt. We hear about their recent investigation into problems plaguing emergency medical services in Illinois. This runs about 15 minutes.
Representative Lisa Dugan and Don Moffitt, thank you for joining us again on the Illinois Channel. And one of the issues we wanted to cover is an issue that you have jointly worked together, having to do with rural health care, following a series of hearings, I would say, you had around the state. Representative Dugan, if you would just give us an overview first of what the issue is and what your hearings were trying to ascertain.
Well, the EMS task force that Representative Moffitt and I co-chaired, it was we traveled throughout the state talking to EMS providers because there was an issue we were made aware of that really told us, there was some concerns out there some problems out there, and we really needed to learn them firsthand. So we went, like I said, around the state, and we met with EMS providers, hundreds of them, all over, and talked about some of the barriers that they're finding, some of the concerns that they have, and the fact that we in the state need to understand the vital importance of EMS services. And it seems as though in some parts of the state, because of the volunteer portion of a lot of EMS services and ambulances and that type of thing, that there's a concern in this state, and there should be a very big concern to make sure that EMS continues to be a vital program. And when people do call 911, we want to make sure that when they call, there's actually somebody that's there to answer the call.
I was going to say, first of all, EMS, I think everyone knows what we're talking about, people arriving with ambulance services. And just as you had mentioned, it's easy if you're living in a metropolitan area, perhaps a Chicagoland area, you're going to say, well, what's the big deal? You call an ambulance and it shows up. Tain't necessarily so if it's going to be in a rural area. I mean, you could run the risk of calling and not having someone there because it is, as you say, a volunteer service. And the other thing, as I understand, is that there's just not always enough people to go around. That whereas I understand the rules under public health might be to have 2 EMTs per ambulance, you may only have one that's available. Am I correct in that?
Yes, that was one issue that was brought up, and that's something that we know we need to address in the state through rule or through legislation. So there's a lot of issues that came up and things that are making it difficult. So that's what the task force report that Representative Moffitt and I will give to the General Assembly that will lay out some of these issues that need to be addressed, however we need to address them in the state. And it'll take some time to address them all. But I wanted to mention, when you talked about the fact maybe when you live in Chicago, this isn't really an issue and it's only a rural issue. And we found through these hearings that even within urban areas and in the city of Chicago, you have the resource hospitals that are part of this EMS system that are also having some problems because there's no funding that goes along with this. And so you have some issues also in larger areas along with rural. They may be different types of problems, but the EMS system throughout the state is certainly got some major problems that we need to look at and try to get fixed.
And that's a surprise to me, I know, hearing this. I had done some reporting years ago about the rural areas and was somewhat familiar with it. Representative Moffitt, tell us, if you would, just what were some of the specific things that you found out and might have been surprising to you in the course of hearing testimony?
Well, it was continually reinforced that the requirement for 2 EMTs on an ambulance was no longer practical. That there would oftentimes be a community have 1 EMT, but they would have a qualified driver or first responder, and that if we could change that regulation so that that would be an appropriate response. Another one was that what's called the Ohio plan, the state of Ohio adopted a plan where the one person could respond with the ambulance, and as long as they were in communication or had communication from the other responder, they could meet at the scene. This could drastically improve response time. And if we're talking emergency medical services, response time oftentimes is the deciding factor. Just as a rule of thumb, in the case of full cardiac arrest, each minute of delay in getting a response and giving proper attention, whether it be with a defibrillator or whatever, reduces the chance of survival by 10%. So if 5 minutes has gone by, there's only 50% chance left of survival, just as a rule of thumb. So response time, the requirements that were there. So now we're looking at, in Department of Public Health, we've been working with them. They were stakeholders. They were at every hearing. They believe that through rules, we can change that to where one EMT and a driver would be an appropriate response. We have to change the rule, but we're working together on that, and I'm very pleased to report that. The other is looking at and probably adopting what's been considered the Ohio plan, where one person could, we're talking volunteer, one person could take the ambulance to the scene, the other person responding could meet them there, saving time, improving the response time.
As I understand it, then right now, under the rules that are in force, both people would have to meet at wherever the ambulance is and then go out to respond to it.
Yeah.
And that's obviously going to delay getting to the scene of an accident or wherever the emergency is.
So that's what we heard frequently. Another one was funding. Certainly funding is a problem throughout Illinois for EMS. In the case of volunteer systems, they might have to have fundraisers. The 911 funding, we have 911 call centers that are on the brink of shutting down, and we're going to have to look at that.
Why is that? Why are they on the brink now?
The main reason is the shift from landlines to cell phones, and there's more revenue produced on landlines than on cell. So as more and more people have cells only, the revenue for funding our 911 call centers is actually decreased, and of course their costs are going up. So we have to look at some way or another to improve the funding for our 911 call centers. That all goes back, when someone calls 911, they expect there to be a response, expect someone to answer.
Representative Dugan, your legislation, what specifically would it address? I mean, how does it address these issues that you've uncovered?
The legislation.
Are you proposing legislation to address?
We're actually now developing and getting ready to present the EMS task force recommendations to the General Assembly, which we'll be doing in April. That will list all of the concerns and issues that were brought to us in all of these hearings, and some of our suggestions as to both from us and the EMS community as to what could be done to help alleviate that problem or that barrier. And the Lieutenant Governor, who also, her office, very involved with us on this. So now we're going to bring the stakeholders together, get the report done, present it to the General Assembly, and then from then out, we'll start to address things legislative-wise that have to be addressed legislatively. Certainly, as Representative Moffitt said, the Department of Public Health believes some of these issues can be done through a rule change, which they're willing to do. So then we start to work on the process of trying to correct it. I know Representative Moffitt and I are co-sponsoring the House Resolution 872, which today we just passed in committee, to make it highlight in this state that EMS services has to be an essential service and recognized as an essential service. We found through these hearings, which was amazing to I think many of us, that the EMS system in the state of Illinois is not even really considered an essential service. And we of course believe that it needs to be. So that resolution actually says the state of Illinois will recognize EMS as an essential service.
That is a surprising finding. And
Yes,
who decides whether it's an essential service, and is that a legal meaning behind that classification?
Well, and I'm not quite sure how it works. I know that they do have to adopt it as an essential service in order for now communities, and when we get into funding and when we look at how do we put this program into place and what needs to be in each county or to make sure that EMS services are provided. I think this is all part of that big picture, and since it never really has been, I believe from what we were told from the Department of Public Health, at one time it was, and then back in the 1970s, we understand, and don't quote me on those dates, for whatever reason, EMS services no longer was classified as an essential service, and so we're trying to highlight that, and I think we may even look at more a legislative fix to that particular issue, but at least this resolution brings it to light, because I think many, such as yourself and I think both of us, when we were informed that it was no longer considered an essential service in the state of Illinois, we need to make sure that it is.
I would just like to add here, number one was to thank the Speaker and Minority Leader for supporting this resolution and establishing the task force and appointing the members. It was bipartisan. We did not view any of this as partisan issues. So that was to their credit that they appointed this. The other thing is, it would be easy if you live in a community that has all the equipment that they need and all the staffing that they need, perhaps full-time paid staff, whether it's in a large city or the suburbs or whatever. You think, well, we're taken care of here. This is probably not an issue that is of concern to us, but it is as you travel around the state. because whether it's that person traveling or their children off to college or friends, as they travel the state, the response that they would get in an emergency situation would be what's provided for that local community. It might be a volunteer service. So it is important to everyone in the state of Illinois that we address this issue.
You know, it goes to show, I think, again, it's one of these things that so many of us, as part of a society, we don't focus on what's the infrastructure needed to have ambulance services or where. And as Representative Moffitt just said, if we're taking a family vacation from Chicago and driving to Florida, we could be in one of these areas where the response time may be delayed, and it might mean that some of our family would die unnecessarily if we were in a car accident. Or maybe there just isn't someone to show up. The other thing is there's not only funding, I think, but part of the issue is sometimes the regulatory rules that Representative Moffitt and I were talking off camera. As I understand it, that some nurses who might be well-trained can't use their nursing skills to the same degree if they're in the back of an ambulance as they might otherwise. Is that something you found? Or?
Yeah, and it is hard to believe. Some of the things we found, yes, and that was one of them. It seems as though there's some regulatory issues. There's also some training issues. That came up quite a bit, as far as to certain groups of people with medical experience only need a certain amount of training and others need a lot more. And when you're looking at volunteers and when you're looking at people who then have to pay for that training themselves, fortunately for the state of Illinois, we have very dedicated and passionate people that do this service regardless of the fact that it costs them their own money. They have to go through a lot of training. So we're also trying to look at those regulatory and the requirements that in the state of Illinois to see if maybe some of them are way over the edge that are helping to being part of this concern and this problem that we're having in the state with starting to lose EMS services, or at least the threat of EMS services closing up because of some regulatory and requirements. So we're looking at those too.
And as we said, the law of unforeseen consequences are shifting from landlines to cell phones, and the funding mechanisms change. And I'm sorry, Representative Moffitt.
I think what your question there on, for example, a registered nurse maybe working as a volunteer on an ambulance service is under the current law would be limited to like if the ambulance is an EMT service, they can only perform the duties that an EMT can. It's really called scope of practice. And if they're licensed to be able to do more advanced medical procedures to save a life, is my opinion. And I think Representative Dugan's, and I think we see eye to eye on all this. Right. We think they should be able to perform to the highest level to which they are trained and licensed to do to attempt to save a life.
And to be clear, you're saying that if they are trained as a nurse, I mean, I just want to lay this out in black and white. Currently, if they're in the back and operating as an EMT, they're going to be limited in the scope of the services they can provide a victim.
Right, that a licensed EMT would be able to perform. And so I think some overlap with military. People that are trained for medical responses in the military would be, if they're trained to do something in the military, they should be able to in civilian life too.
Okay, well, I know time is short and the House is about to come in, so we'll let you go, but thank you for joining us. And again, this, I think, underscores there's all kinds of issues, and it's not, certainly emergency medical services, not a Republican or a Democrat issue. Right. It's the kind of thing that the legislature can address that really impacts so many of us, all of us.
That's
yes.
right.
All of us. Thank you both for joining us,
you.
and we'll look to follow up with you.
Okay, thank you.
Thank you.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.